podcast today on the live show today. This guy is an expert. When we say expert, we had to do a research to make sure it's true, and it absolutely is. We got the doctor, the good doctor, Dr. Leslie Ray Matthews, known as the top vitamin D expert in the land. And this is a vitamin I take every day because I take my health seriously. He's going to tell us all the ins and outs about it. How you doing today, Doc?
Doing great, Reece. Thanks for having me on your show.
Absolutely. Now a vitamin D expert, how did you fall specifically into this one vitamin? Say, you know what, I'm gonna take this by storm.
Well, I'm a trauma surgeon by trade, and so we deal with critical care patients. Patients have been shot, stabbed, fall off bridges, assaulted, and just any type of trauma to the body. Yeah. So these are usually the sickest patients in the hospital. So I've always been a person that always tried to look for ways to improve. So vitamin D is not a vitamin, it's a hormone. So it's a hormone and it's an anti-stress hormone. So anytime your body is stressed, you actually need more vitamin D. So it helps your body deal with stress. So actually I said, wow, this can actually alter the lifestyle of my patients and to help them get better, lower my mortality rate, decrease my wound infection rate. So who wouldn't want to know how to use something like that?
Everybody should want to use. Matter of fact, I think I need to go home and take a few more extra pills today. Go through stress every day. And you're talking about a time where people are dealing with things that are not just directly dealing with the pandemic, but ancillary things like you may have a loss in wage, you may have a lost family member, you may have people sick at home, or you may have a more stressful work environment.
Oh, definitely. I worked 100 hours a week for 32 years. And so you're getting 2 to 3 hours of sleep a night. And so it actually kept me going too. So I very seldom got sick, very seldom caught anything. I was exposed to all different diseases operating on people. And then so I'm training residents to operate. So occasionally, they'll nick you with a needle. So I had to protect myself and make sure I never caught anything. So in my 32-year career, I was blessed not to catch anything ever.
Hold on, wait a second. We can't just breeze past that. We have a thing called the hype bell. I'm going to hit it because how do you work in a hospital? You got people coming in and out with anything from the flu to a gunshot wound, and you hadn't got sick in 32 years, and you credit that to the increase in the hormone of vitamin D?
Well, vitamin D, like I say, it is a hormone, and basically you have receptors on every cell in your body and every tissue in your body for vitamin D. So that should tell you it's important. Then the way God designed this is a unique vitamin. It takes the sun. We make 90% of the vitamin D by the sun striking our skin. Then it takes that compound and sends it to the liver. Then after that compound is added, it goes to the kidney. So this is a complicated process. No other vitamin or hormone is made like that with the help of the sun. Only 10% comes from the diet. So it's very important. So I said, this is so important that God basically has to use the sun to make it. So imagine the power once you learn how to use it, what you can do with it.
Right now, we got Dr. Leslie. He's like really schooling me right now. I'm taken back a little bit because you say you can get the intake and increase in your vitamin D levels just from getting some sun. But then we had to be in the house for almost a whole year dealing with the pandemic. But you need this vitamin from the sun to kind of boost your immune system. So we kind of working at a complete opposite in what you're really supposed to do in life.
Well, no, actually, we had to shut down during the pandemic. I agree with that. But, you can supplement. There are different forms of vitamin D that you can get.